Hello everyone, my name is Hasmin. Welcome to my presentation. Our topic is all about city neuroanatomy. City neuroanatomy. The aim of this video is to provide an introduction to cross-sectional anatomy by presenting just a few representative slices from some of most common examinations performed in the city department. Okay, for today we will discuss the cross-sectional anatomy of cranial city with contrast and bone window. Routine scan of the brain usually begin at the base of the skull. This is the base of the skull and continue from here. Depending on the clinical indication, the scan may be done without IB contrast enhancement, with IB contrast enhancement, or without and with IB contrast enhancement. Anatomy. Number 1 is the nasal bone. Number 2 is the eye lens. Number 3 is the maxillary sinus. Number 4 is the bomber. Number 5 is the sphenoid bone. Number 6 is the medulla oblongata. Number 7 is the occipital bone. Number 8 is the vertebral artery. Number 9 is the mastoid air cells. Number 10 is the zygoma. Number 11 is the eye globe. Number 12 is the ethmoid sinus. Okay, second image of cross-sectional anatomy. Number 1 is the medial rectus muscle. Number 2 is the globe of eye. Number 3 is optic nerve. Number 4 is the sphenoid bone, greater wing. Number 5, mandibular condyle. Number 6, mastoid air cells in left temporal bone. Number 7, sigmoid sinus. Number 8, pons. Number 9, cerebellum. Number 10, internal auditory canal. Number 11, auricle. Number 12, external auditory meatus. Number 13, lateral rectus muscle. And number 14, zygoma. Third cross-sectional image. Number 1, frontal sinus. Number 2, pituitary. Number 3, sphenoid bone. Number 4, middle cerebral artery. Number 5, temporal lobe. Number 6, mastoid air cells in left temporal bone. Number 7, sigmoid sinus. Number 8, occipital bone. Number 9, cerebellar peduncles. Number 10, cerebellum. Number 11, right lumboid suture. Number 12, fourth ventricle. Number 13 is the basilar artery. Number 14, sella turcica. Number 15, temporalis muscle. And number 16 is the frontal bone orbital roof. Fourth image. Number 1 is the frontal bone. Number 2 is the falx cerebri. Number 3 is the anterior cerebral artery. Number 4 is the middle cerebral artery. Number 5 is the lateral ventricle, temporal horn. Number 6 is the parietal bone. Number 7 is the cerebellum tentorium. Number 8 is the internal occipital protuberance. Number 9 is the port ventricle. Number t- Number 10 is the posterior cerebral artery. Number 11 is the basilar artery. And number 12 is the temporal bone. A radiology technologist practicing in any field of radiology must understand basic human anatomy and physiology in order to perform his or her duties. Those working in CT must also be able to identify normal anatomic structures on cross-sectional cranial images. This is the PIP images. Anatomy. Number 1 is the superior sagittal sinus. Number 2 is the frontal bone. Number 3 is the lateral ventricle anterior horn. Number 4 is the caudate nucleus head. Number 5 is the putamen globus pallidus. Number 6 is the third ventricle. Number 7 is the choroid plexus. Number 8 is the parietal bone. Number 9 is the internal occipital protuberance. Number 10 is the cerebellar vermis. Number 11 is the pineal body. Number 12 is thalamus. Number 13 is the internal capsule. And number 14 is the temporal bone. Each cross-sectional image is accompanied by drawing in shades of gray to help identify the structures. This is the 6 images. Anatomy. Number 1 is the falx cerebri. Number 2 is the frontal bone. Number 3 is the corpus callosum. Number 4 is the caudate nucleus body. Number 5 is the parietal bone. Number 6 is the confluence of sinuses, turcula. Number 7 is the occipital lobe. Number 8 is the choroid plexus. Number 9 is the lateral ventricle body. Number 10 is the temporal bone. Number 11 is the corona radiata. And number 12 is the straight sinus. Last image. Anatomy. Number 1 is the frontal lobe. Number 2 is the superior sagittal sinus. Number 3 is the precentral gyrus. Number 4 is the central sulcus. Number 5 is the falx cerebri. Number 6 is the parietal lobe. Number 7 is the parietal bone. Number 8 is the temporal bone. Number 9 is the scalp. And number 10 is frontal bone. All the drawings have been done according to the same gray scale. Regardless of where they are found in the body, air is depicted as black, bone is white. Within these extremes, shading varies for tissues, organs, and abnormalities. Each cross-sectional image is also accompanied by reference image to help the reader imagine its location in the body. Okay, that's all for today. I hope you gained some knowledge in this video. Hope you like it. Please like and subscribe for more updates and topics. Thank you for watching.